Excellencies, ladies and gentlemen, dear friends and colleagues, good morning, everyone. Welcome to this briefing on the current prevention and control situation of the novel coronavirus. I'm very pleased to introduce our speakers, the permanent representative of China, His Excellency Wang Gun, and the medical director of the Vienna International Centre Medical Service, Dr. Matthias Laderman. Before I hand over to Ambassador Wang, let me just mention three quick logistical points. First, the briefing is being webcast to UN staff in the field, and this webcast is being recorded, and we will place it on our website after the briefing. Second, and importantly as well, interpreting between English and Chinese is available. And lastly, after our two speakers have briefed you, there will be the opportunity to ask questions. And with that, I'd like to give the floor to you, please, Ambassador Wang.
Thank you, Martin. Good morning, our colleagues, excellencies from the international organizations, from the missions, and from the media. Good morning. 非常感谢维也纳来自维也纳的国际组织、各国代表团和媒体的朋友出席今天的吹风会。
You must have been following the news about the novel coronavirus epidemic that recently emerged in China. I would like to take this opportunity to give a systematic briefing in combination with the multilateral diplomatic activities in China on the latest development of the epidemic prevention and control, as well as the countermeasures by the Chinese government and the things we in the diplomatic community here in Vienna should keep in mind. It is my hope that my briefing would enable you to have a more comprehensive, accurate, and objective understanding of the current situation. This novel coronavirus outbreak originated locally in Hubei province of China, to be more specific, in Wuhan of that province, before spreading to other provinces and cities. This epidemic is caused by a new novel coronavirus. The name of this coronavirus is 2019-nCoV. This epidemic is transmitted mainly via respiratory tract. But now it is still yet unknown as to the infection source. And also, the mechanism of transmission, infection, and also the mutation of this new virus is still unknown. We have recently made big progress in our research, but no definitive conclusion has yet to be drawn. The Chinese scientists have successfully separated the strain of this new coronavirus. Now, some figures as of 10 minutes ago. The China National Health Commission has received reports and statistics. Altogether, there are 9,809 cases, confirmed cases. Among them, there are there are 1,527 cases of critical conditions. $15,238 suspected cases. On the accumulated basis, there have been 213 cases of deaths. At the same time, there have been 179 cases of recovery and hospital discharges. In Austria, according to the official website of the Austrian Health Ministry, as of 10 o'clock yesterday, there were no suspected cases in this country with the diagnosis of no infection in the previous suspected cases. Dear colleagues, dear friends, at present, to fight this new coronavirus epidemic is the most important work for the Chinese government and also for the Chinese people. We have been united together, adopting multiple meticulous as well as the most comprehensive, the strictest measures. To put it simply and specifically, we have been taking robust measures in the following 5 aspects. Firstly, politically speaking, President Xi Jinping convened a meeting on the Chinese New Year's Day to deploy related measures himself. And after that, he has also made many important instructions. President Xi stressed that people's life and health should always be regarded as the first priority. China will do its utmost to protect the life and health of its own citizens. This is the purpose for us to carry out the epidemic control and prevention. At the same time, we will do our utmost to protect all the foreign nationals and the staff of foreign diplomatic agencies in China, to protect their life as well as their health. In terms of institutional mechanism, the central government has set up the leading group to handle the epidemic. This group is led by Premier Li Keqiang. This leading group provides unified leadership and provides guidance and command for the efforts to be taken in different places in China. At the same time, the China National Health Commission, together with other departments, has set up a joint prevention and control mechanism for rapid action and coordination in enforcing different countermeasures. As for the epidemic-related foreign affairs, the Ministry of Foreign Affairs of China has set up a dedicated emergency response mechanism to deal with the epidemic-related foreign affairs. In Vienna, a leading group for emergency response was also set up within the Chinese permanent mission, and I am the chair of this group. This group is responsible for prevention and control within the Chinese mission and responsible for liaising with the VBOs and other missions on epidemic-related matters. Generally speaking, China has already established a comprehensive multi-layer prevention and control mechanism covering both the central and local authorities as well as the domestic and overseas places, with the focus on Wuhan and Hubei province. All the measures are being implemented in an open, transparent, scientific, and orderly as well as precise manner. Now, I would like to brief you on the specific measures we have been taking. First, on the basis of the principle of jurisdiction, the Chinese government has mobilized the whole country in and adopted multi-countermeasures to prevent the further spread of the epidemic. Altogether, 8 aspects. First is the disease backtracing and technical guidance. The experts identified the pathogen within the short period of time. A little more than 1 week, we had preliminarily identified that the coronavirus, the new coronavirus as the pathogen, which is different from the SARS virus, although there are a high degree of similarities between those two. Second, giving guidance to Wuhan of Hubei province to enforce various prevention and control measures. In Hubei province, all the patients are quarantined centrally for treatment. All the close contact people are under medical administration at home. And strict control is applied to people who have moved into or out of Wuhan in an attempt to disrupt the further spread of the epidemic. Third, enhancing the epidemic prevention and control throughout the country. Now, 30 provinces have already initiated the first level response to a public health emergency. At the same time, we have been very practical. We have strengthened accountability. Those who have not done diligently will be held accountable. Yesterday, the leading group of the central government went to Huanggang city of Wuhan province while asking the director of the Health Commission some questions. That director failed in answering any of the questions. On the same day, that director was fired, and the relevant information was made public on media. Fourth, no efforts have been spared to treat the patients. Fifth, accelerating the relevant R&D research and development. A national R&D expert group has been set up to initiate an emergency project for targeted research. Six, communication and interpretation. Every day, before 8 a.m. Beijing time, the National Health Commission would publish the epidemic data for the previous day and invites experts to interpret the data for the public and inform the public ways of prevention and control. This information is made public on a timely basis in an open, transparent manner. Seventh, deepening international cooperation and exchanges. I will come to this point in more detail later in my briefing. The eighth is about the medical measures we have been taking. This is the most important part of my briefing. 4 aspects as well. The first is that a guide on diagnosis and treatment and plans on emergency monitoring and plans on emergency monitoring, epidemiological survey and sampling techniques were developed immediately. The test kit was developed, and after evaluation, the test kit was distributed to medical institutions to enable those medical institutions to better identify the cases. Second, a list of designated hospitals in different localities was published. Medical treatment has been enhanced, and the cases of critical conditions are handled in a tailor-made manner to minimize cases of death. Third, a subsidy policy for the patients is being implemented to make sure cost would not hinder treatment of any patients. Fourth, coordination has been made to dispatch from the Central Medicine's Reserve medical supplies to Wuhan. More than 1,300 medical personnel have been sent to Hubei province as well as to Wuhan of that province. And at the same time, 8 teams composed of more than 1,000 medical staff are in standby mode. Apart from all these medical measures, I would like to say something about the materials for prevention and control. This is not a key part of this briefing. Simply speaking, I would like to say that China has taken all possible measures to ensure the material supply for prevention and control. Dear colleagues, at the time of the outbreak, there are many measures we can talk about, but there's still one issue which concerns every aspect, that is, whether the measures we have been taking can work. In this connection, I would have to talk about the information issue. And there have been some media articles on this point. These articles are about the information issue, information disclosure issue in China this time when this new coronavirus broke out. I would like to borrow the words from President Xi Jinping when he met Dr. Tedros, the Director General of the WHO. President Xi Jinping said that the epidemic is the devil, but we cannot afford to allow the devil to hide itself. The Chinese government has always to disclose information on a timely and in a transparent manner to disclose the information about the epidemic, and has been actively responded to the concerns and has strengthened relevant international cooperation. Information disclosure and information transparency has bearing upon the confidence on the part of the international community, and also has a bearing upon the interaction between China and also the rest of the international community. Here in Vienna today, we are holding this briefing precisely for the purpose of presenting the VBO's various missions and the media with the latest, the most direct information, so that you could help your governments understand the latest development, so that there would be greater confidence to win this battle against this epidemic. I believe this is also something China should do as a responsible country. First, I would like to brief you on China's cooperation with the WHO. We all know that on the first instance, China informed the WHO of this outbreak and shared with the WHO the technical information, as well as the full, complete genetic sequencing of some virus strains. On the 29th of January, at his meeting with the Director General of the WHO, Dr. Tedros Adhanom Ghebreyesus, President Xi Jinping stressed that China attaches importance to the cooperation with the WHO and stands ready to work with the WHO and the international community to maintain the regional as well as global health. Dr. Ghebreyesus, the Director General of WHO, acknowledged this. China also organized the in-depth technical exchanges and discussion between the Chinese experts and the WHO experts. And also we have invited the WHO experts to go to Wuhan to have an in-field study tour. And with the invitation of the WHO, China participated in the WHO IHR Emergency Committee meeting and made a presentation on the epidemic as well as the countermeasures taken.
Second, Chinese diplomatic representations around the world are maintaining close communication with host governments, sharing information about the outbreak and about our prevention and control efforts on a timely basis to address their concerns. In particular, we have shared information with national health authorities of Japan, Thailand, South Korea, and the US, and with their embassies in China. And we have shared with them information and intelligence, and verified with them information about suspected and confirmed cases. Third, as for the diplomatic corps and foreign nationals currently in China, the Chinese government will fulfill its international obligations. We will provide timely diplomatic, on a timely basis, the diplomatic corps in China with accurate and comprehensive information. We will provide foreign nationals in China with the necessary assistance and help in accordance with our relevant rules, so as to address their legitimate concerns and ensure their safety in a responsible manner. For some time now, many countries and the WHO have fully recognized China's strong and adequate prevention and control measures. They have thanked the Chinese government for its cooperation and transparency, and they have expressed understanding and support for our prevention and control measures. And in this regard, we would like to express our sincere gratitude. Here in Vienna, we will further strengthen cooperation with VBOs and with other permanent missions by timely sharing information and by maintaining communication and coordination so that together we fight this outbreak. Dear colleagues, dear fellow diplomats, well, I think maybe you now have a question. At this stage of this outbreak, what's your assessment of this outbreak? Last night, WHO convened yet another meeting to discuss the outbreak and decided to declare the new coronavirus a public health emergency of international concern. However, Dr. Tedros, WHO's Director General, at the same time made a statement saying that actually this declaration is not a vote of no confidence against China. On the contrary, WHO remains fully confident about China's capability to prevent and control this outbreak. For this question, China has always maintained close communication with the WHO. Those who know the Chinese well know that the Chinese hold a philosophy of hoping for the best but prepare for the worst. And our prevention and control measures are deployed based on the assumption that the situation is worse than what we believe it is. In that way, our prevention and control measures could be stronger and more comprehensive. However, we need to have an objective assessment of this outbreak based on scientific evidence. And I'd like to make the following points. First, the outbreak first occurred in China. We are fully confident that we have the capacity to defeat this outbreak. Well, this is not something out of the blue that we say. First, China enjoys an advantage that is inherent in its socialist system. We have the strong capacity to mobilize and organize the whole country to prepare ourselves to fight the disease. With very short notice, we have the capability to organize the whole country top-down to fight the disease. Second, China has accumulated a lot of experiences in responding to public health events like the 2003 SARS, H1N1, avian influenza, and Ebola. And these experiences are beneficial. Thirdly, since the founding of the People's Republic of China 70 years ago, and especially since the reform and opening up 40 years ago, China has enjoyed rapid scientific, technological, and economic development, and providing us with a strong material basis for us to fight the disease. So these three advantages form a strong foundation for China to combat this outbreak. As we can see, from identifying the pathogen as the new coronavirus to proactively and timely sharing relevant genetic sequencing information with the WHO and other countries, China managed to do it in only a little more than 1 week, setting a new world record in the rapid confirmation of a new virus infection. China has decided to build in Wuhan 2 temporary hospitals dedicated to treat patients infected with the new coronavirus. And these 2 hospitals have been built within 7 days and have been put into operation within 7 days. And we have made the swift decision to declare the new virus a Class B infectious disease. And we have moved decisively to temporarily shut down all exits from Wuhan. And we have raced against time and engaged in a massive campaign covering a population of 1.4 billion to protect public health. All these remarkable measures and progress can be attributed to the advantage of China's socialist system, to our experience in fighting outbreaks, and to the scientific technology and economic basis we have built up over the years. So in assessing the current situation, we need to take into account all these factors. Second, the WHO Director General last night in his statement talked about 7 recommendations to respond to this outbreak. In his recommendations, he talked about a vaccine, R&D, diagnosis and treatment, emergency preparedness, identification of infection sources, and cutting transmission chains, etc. I would like to say that in all these fields, actually, for quite some time now, China has already adopted measures. Not only we have adopted measures, our measures are actually more comprehensive than those recommended by the WHO. And this is one of the reasons why WHO's Director General spoke highly of the efforts by the Chinese government to prevent and control this outbreak. This morning, the spokesperson of China's Foreign Ministry said that the prevention control measures we have put in place now is the most comprehensive and the most strict. Most of them far exceed the requirements of the international health regulations. In his statement, Dr. Tedros said that the measures adopted by the Chinese government are extraordinary and indeed commendable. So we are not only psychologically prepared for this disease, and we have made we have adopted adequate measures to prevent and control this outbreak. And we have clear targets. And we have moved swiftly and precisely, and we have responded robustly. So, in one sentence, our prevention and control measures are based on the science and are rolled out with order and precision. And our prevention and control measures are showing results. We have full confidence that we have the capacity to eventually defeat this outbreak. And now I'd like to make some comments related to the situation in Vienna. We all know that the IAEA, UNOF, UNODC, UNIDO, CTBTO all have some meetings scheduled for the coming days and weeks here in Vienna. According to original plans, China would send delegates from China. Meanwhile, some international organizations have planned to send staff to China for exchange and cooperation. How to deal with this personnel exchange? It is the responsibility of our delegation to work together with VBOs in accordance with the latest information, so as to coordinate our efforts. And I would like to say that our principle of work is to cut the transmission chains of the outbreak and to reduce the transmission risk to the minimum. Therefore, in accordance with this principle, for the upcoming meetings, we have studied them and made some classifications of the meetings. Taking into account the nature of relevant meetings, as well as the health of participants originally planned, as well as other factors, we have made some recommendations to our colleagues in China. First, for essential meetings, we suggest that China's delegation be downsized. For non-essential meetings, we suggested not to fly participants from China. In addition, side events originally planned to be hosted by China will, as appropriate, be cancelled. Second, meeting participants flying from China. We need meeting participants coming from China, but we will ensure that these participants do not come from and have not recently traveled to Wuhan and other affected areas. They have not been in contact with patients infected with the new virus, and they themselves do not show any symptoms. China will do all it can to ensure that Chinese participants will not be a danger for the spreading of the disease. Of course, on the basis of humanly possible and scientifically possible, we will do all that we can to ensure that Chinese participants will not spread the disease. Will not entail the risk of such transmission. Third, China will act responsibly, and as a voluntary measure, China is willing to timely inform all meeting participants of the health situation of participants coming from China. When they are here, Chinese participants will conduct their activities in a rather limited area or fixed area. And they will record information related to the people they come into contact and the place they go when they are here. Fourthly, China's permanent mission will ask meeting participants flying from China to report their health situation on a daily basis. And in case of illness, they will be immediately sent to the Joseph Hospital as designated by Austrian authorities for quarantine and treatment. In addition, we would like to thank the Unit of Medical Service for the relevant recommendations. Chinese participants will strictly follow VIC medical and prevention control recommendations. All in all, we hope that these measures could help VBO's prevention control efforts. As said by WHO Director General Dr. Tedros last night,
beat this outbreak is for all countries to work together in a spirit of solidarity and cooperation. We are all in this together, and we can only stop it together. 所以的话
So we are ready to work with delegates, with VBOs, with friends from media to fight the disease, to address the challenges of our time, and to win this battle against the outbreak. We are fully confident that we can defeat this outbreak. I would like to say that during this period, China's permanent mission has set up a hotline, and we will have dedicated personnel and for information related to the hotline and related contact information, the Secretariat will distribute them to all delegates. We are ready to do our utmost, and we thank you for your support. Thank you.
Thank you very much indeed, Ambassador, for this extremely comprehensive briefing. And I'm sure that there will be questions. What I would suggest, though, first of all, is that we turn to Dr. Laderman, who's the medical director of the Vienna International Centre Medical Service. And he has a presentation that he would like to give us. And then after that, I think I would open the floor for questions. So please, Dr. Laderman.
Thank you very much. Thank you for inviting me to give you a little update about the efforts the UN Medical Service does, and especially what we do here in the VIC. Just go for the slides. Next, there. As you know, we are referencing our recommendations on WHO recommendations, which is our reference center. Now, from the latest update, and these are always from the day before, you see the numbers there. We have heard the more actual numbers from Ambassador Wang. Thank you. That is on this slide. Now, the new situation is that the WHO declares the new coronavirus outbreak a public health emergency of international concern. That has some implications, especially in reporting from countries to the WHO, and especially reporting when they implement additional health measures. Next slide, please. If you look at the travel recommendation update, and that's from the 27th of January, and it's in discussion with the WHO at this point. But at this point, they don't recommend any specific health measures for travelers. Now, in case of symptoms suggestive of respiratory illness, during or after travel, travelers are encouraged to seek medical attention and share their travel history with their healthcare providers. That's the WHO general statement. If you look what the United Nations did so far, the UN medical directors regularly meet or do a teleconference updating their responses, also the recommendations. There is a dedicated website where you can get additional information. Unfortunately, on this slide you can't see that, but you are able to get the slides later, and the website is visible. You see also in the announcement from UN New York, from DMOSH, Department of Management, Operational Support and Occupational Health and Safety, some more guidance, and especially for the staff and the medical clinics in the field who take care of UN staff in the field about hygiene, health preventions. There are some very good posters, leaflets, and also question and answers, which are available to all staff from all UN agencies. Now, here in Vienna, the VMC Medical Service is on one point following UN guidance and WHO guidance, but also the Austrian health authorities' public health advice and recommendations. Now in Austria, they have stepped up their surveillance like a week ago, and stepping up surveillance in that sense means coronaviruses were not reportable before, coronavirus infections were not reportable before, but they implemented a mandatory reporting of suspected coronavirus cases. For this suspicion of presumed cases, they also provided a case definition, and the case definition has to have a travel history to the Wuhan region And it also has to have certain symptoms. The travel history should be in the last 14 days, because that is, as current knowledge, a 2 to 14 day period of incubation before symptoms may occur. But all this too has to come together to have a presumed case. And you have to have a definition of, if you talk about contact, close contact. And close contact means, according to the case definition being used, 15 minutes close face-to-face with a person who is infected or confirmed infected. So these are the key features, I think, which one should keep in mind if one thinks about, can I be potentially infected or not? What did we do in the VSC Medical Service so far? We have sent out 3 information notices to all staff in all VBOs, Vienna-based organizations. We have also done promotional material, posters, and we have, of course, set up our own chain of response in case that there will be a presumed case to have to be investigated or followed. We were in contact, and with the Austrian health authorities, public health authorities in Vienna, as well as the Kaiser Franz Joseph Hospital, in case that we have such a question or suspected person who needs fulfills the case definition. And in that case, what would happen is that that person would be transported with the ambulance service to the Kaiser Franz Joseph Hospital, being observed, and within normally 1 or 2 days, the test result will be back and either can confirm or rule out the infective status. So far, and I'm sure you know this, in Vienna, in Austria, there is no confirmed case, and all suspected cases have been negative. We are closely watching the situation in Germany, in Bavaria, if you have heard of that, where there is a case at the workplace being infected, which for us is very important, because we would like to see how many persons who are being right now investigated for and tested around that index person who was confirmed positive, because it would give you an indication how fast and how long you have to be in contact with a co-worker at this point to be infected. Preliminary data from 17 workers who have been tested around that confirmed positive case, first case, are 17 of the 90 persons is negative. Yes, there are a few others confirmed, but all of them have a mild disease or are asymptomatic. At this point, if you look at the imported cases to other countries, most of them have a travel history to Wuhan. Almost all of them have a mild disease. Only 1 severe case of the imported cases in the other countries is severe. And yes, we have indication that there's a human-to-human transmission, but the indication so far seems to be, again, the close contact, not the passing by of a person. In answering the most frequent questions in the last days, what do we do with an asymptomatic person returning from their travel from China with no contact or no travel history for longer in Wuhan? At this point, that person can go back to work and doesn't have to stay at home. Also, the Austrian health authorities have not imposed any home quarantine for any travelers returning from China. In the UN system, we although say that if there is a concern of a staff member, her or himself, and wants to maybe self-quarantine for stay home, it should be a manager's flexible decision to allow working from home. From the medical side, the infectious risk to be at work if you're asymptomatic is minimal. And the key message, if we put this together, what we know right now, there is prevention measures which we do for the flu, influenza season and recommend it regularly, which is ongoing at the same time right now, as well as the coronavirus epidemic outbreak in China. The preventive measures, you do simple washing your hands, sanitizing your hands, sneezing in your cough etiquette. We talk about sneezing in your tissue or in your elbow, arm, washing your hands after you used your tissue, and if you have symptoms, don't come to work or cover your use a face mask, cover your mouth and nose. Only for persons who have symptoms that would make an impact on the infectious chain, because it would avoid that you're coughing away big droplets to other people. Where the recommendation comes in to stay away or distance yourself or avoid handshaking is because we know that droplet airborne infections travel about 1 to 2 meters in distance, and that's where the close contact definition again comes in. If you avoid close contact to symptomatic persons, you're very much on the safe side. You may have heard all these recommendations. They're very general, but they're always the same because they apply to the influenza season. And we're much more worried right now about influenza cases than about a coronavirus infection in Vienna, in Austria, and in the VIC. Thanks.
Thank you very much, Dr. Laderman. So, questions, if you have them. I recognize, please, the representative of Pakistan. Please, the floor is yours.
Thank you, Ambassador Wongkun. I'm really grateful to you for providing us this briefing. I'm also grateful to the members of the officials of the UNOV for arranging this joint briefing. It has been very informative on this new coronavirus. We know it is a challenging time, and Ambassador, we appreciate efforts made by China, efforts China is making for tackling this epidemic, and as members of the international community, we fully support Chinese efforts. You have talked about international cooperation. Since this is a very unique virus and it requires a lot of protection and isolation measures, how other countries, friends of China in the international community, and particularly your neighbors, can provide some meaningful assistance in overcoming this epidemic and this challenge. Thank you very much.
In the first place, I would like to thank you, Ambassador, distinguished Ambassador from Pakistan. We, for our part, attach great importance to our collaboration with our neighbors and as well as other countries in our fight, in our combat against this new coronavirus. At the moment, I think what is most important is that by sharing information, so that our friends in Pakistan know what is going on. In the meantime, and you could in a better position to advise your colleagues if they have pre-engaged event in China or in Pakistan with the participation of Chinese nationals. These information will help you understand better whether these peoples have travel history in infected areas or have contacts with people from infected areas. So I think these informations, if through our bilateral exchanges or exchanges through other channels, as long as they are transparent, will definitely help your efforts to fight this new epidemic. And we think that for us as Chinese, if we can protect our people, it's also a support, a means of support of the efforts of other countries to protect their general public. So we, while appreciating the sentiments of Pakistan to provide meaningful support, I think this could be done in many ways. Exchanges by support the exchange of information at policy level people as well as at the level of experts. And not only, I think, in terms to benefit the people from the two sides, but also I think this is a common challenge in the field of public health, and we would like to see that our efforts be channeled towards this very end. Thank you.
Thank you very much. Any further questions? I'm scanning the room. Kyrgyzstan.
Your Excellency, thank you for presenting transparent and comprehensive information for the permanent missions and staff of the VIC at this challenging time. We hope that applying all modern techniques and strengthening international cooperation, especially with the border countries, we would be able to fight this disease. Thank you very much.
Thank you. Yes, please.
Hello, Francois Murphy from Reuters. Ambassador, you made a slightly cryptic reference earlier. You said China has taken all possible measures to ensure the materials supply for prevention and control. I'm just wondering what you meant there. I imagine you were speaking about medical supplies like gloves, face masks, etc. Are you saying that there's no problem with the supply of face masks and that, you're not worried about that?
I have noted your question. I suppose the discussion of this question may take quite a lot of time.
Very specific context, so at this stage I would prefer, instead of answer questions of this kind, then while being here we could devote more time or focus on the real thing we could do on the ground as policymakers, as diplomats. Thank you.
Thank you. Any other questions? Does not seem to be the case. So, Ambassador Wang and Dr. Laderman, thank you once again for briefing everybody, and thank you to colleagues from the diplomatic community and from the Vienna International Centre. Thank you very much for coming.
Thank you, Martin.